Hello, my name is Isaac Azilla, and I'm here to present my project, Capstone project, on nursing turnover and retention for my organization's nursing division. Nursing turnover has been nationwide. The organization participated in a survey conducted by the National Database of Nurses Nursing Quality Indicator, the NDNQI survey, in 2015. A 86% participation rate of registered nurses indicates good engagement from the nursing division, that they want to have input in their nursing environment. Some outliers and some results of this survey really highlight the importance of leadership engagement and organizational engagement in improving some important factors center around nurses being satisfied with the work that they provide on their nursing unit. Nurses need to feel connected to what they do each and every day, and the organization plays a vital role in improving that work life and the work environment. And the organization ranked 40th percentile nationally for that question. They also ranked 52nd percentile for nurses having enough time to provide high quality of patient care, direct patient care, as well as ranking 45th nationally in the percentile rankings for working within the team and the team dynamics within each unit. And also the nursing division scored 50th percentile for nursing administrators consulting nurses in daily problems, what's going on in the organization, are they garnering the feedback and input from the people that actually deliver that care at the bedside. Also, the organization ranked 42nd percentile for the work contributes to a sense of personal achievement on the nurse's work unit that directly correlates to the first question of the 40th percentile for feeling satisfied with the nursing care. So really the organization has some significant data here that represents that they need to build the connection to the nurse and the care that they are providing. The organization ranked in the 60th percentile nationally for pay. Actually, at the end of 2017, the organization made a 12%, which is a rather significant pay increase for all registered nurses. And the theory behind pay for the organization is they believe in market-based pay. So as the market moves, so will they move the people for that individual role. So the staff feel that they're being paid adequately, which raises the case and highlights the case more for concentrating on work environment. Also, the organization has opportunity for improving development opportunities, scoring in the 51st percentile and the 43rd percentile for professional development access, so getting out from the daily work functions to be able to incorporate professional development into practice. And then the organization scored in the 38th percentile for nurse manager as a good leader for the unit. So there's also opportunity for nurse leaders being more engaged, connecting with the staff, and making sure the communication is essential and, and clear, that nursing division understand the day-to-day functions within the organization. And then last but not least, the organization scored 41st percentile for nurse manager support on the unit. So really getting a team of individuals together to understand what, from the perspective of the nurses, what makes a good leader? What do they want to feel? What do they want to see? How do they want to feel supportive? So that is an important component in moving forward and improving the nurse retention and turnover within the organization. In 2017, the organization made a commitment to enter on the journey to receive the designation for Pathways to Excellence in Nursing. This journey started and it was initiated with development and hiring of a Pathway to Excellence director, and someone to really organize and perform as a cheerleader to meet this organizational goal. They conducted a survey in 2017 to obtain pertinent data to see what kind of opportunities they have to improve. And I think some of this data here correlates with the NDNQI data highlighting the work response. But the first thing that really stuck out to me was the nurse participation rate for the survey was only at 60%. Staff were allotted time to go perform the survey, but really questions the engagement and the current engagement from nurses within the organization. Something positively from the survey, the 19 out of 28 survey questions had a 75% favorable rating. But the survey really highlighted some more consistent things that the organization nurses want to feel and want to feel supported for. There was only a 47% favorable rating for the organization's retention incentives programs here in the organization, and that really solidifies the case in the presentation that I'm doing today. Nurse retention and turnover is imperative, and they want to feel that there is an organizational commitment for nurses to be retained within the organization. There's only a 60% favorable rating for the chief nursing officer being present and accessible within the nurse units. There's also only a 64% favorable rating for input in the daily staffing decisions and a 67% favorable rating for staffing patterns accommodation for educational activities. These were the highlights of the survey and opportunities the organization has to focus on. My Christian worldview plays a vital role in the application of this presentation. I feel that, in my opinion, I feel it's important. The organizational leaders understand that nurses want to feel cared for and that their work is valued. And God has lifted me up in my life to help me connect nursing leadership and to nurses and help foster those relationships. Philippians 2, verse 2, 4 states, do not merely look out for your own personal interests, but also for the interests of others. So we need to look beyond ourselves and into the lives of others to see, wow, what are they feeling today? What are their hardships? What are some things as a nurse leader can we do to lift them up and empower them in their day-to-day functions? Romans states, be devoted to one another in brotherly love. Give preference to one another in honor. And we must respect and honor each other through this journey to improve nurse retention and reduce nursing turnover. But Galatians 6:2 says, bear one another's burdens and thereby fulfill the law of Christ. So giving to Christ and giving to God will help fulfill the reduction of burdens that others have on their day-to-day work environment in nursing. So it is our job as Christian leaders to help improve this environment and support others through the dynamic nature of healthcare. The healthcare organization is centered in Virginia and has 255 licensed inpatient beds. It is a not-for-profit community-owned system, which is one of less than a handful in the state of Virginia, and it serves 5 counties and covers the square mileage of the state of Delaware. This is a very large surface area, but is in the rural part of Virginia, and the populace requires a large amount of territory that garners a wide array of services. The system is governed by a board of directors that are volunteered and live within community. And they offer a wide array of services for a smaller community-owned hospital. They have inpatient and inpatient psychiatric services, a joint center, orthopedic and cardiac services. They have skilled and rehab units within the organization. They have cardiology, a cancer center. They have a vascular center, a robust orthopedics and robotic program. They have over 120 physicians and physician practices, including gastroenterology and endocrinology and hematology and So they're very extensive in the services that it can provide for the community, and they also have some urgent care facilities throughout the county. There's over 2,200 employees within the organization, and almost a third of those are nurses. The organization has received the top 50 hospital rating by Health Grades for 2000 years of 2015 through 2017, and from 2013 to 2015 they were ranked top 100 hospitals. So that's a very prestigious designation from Health Grades. They are certified stroke center by the Joint Commission with a gold rating. They have no penalties for readmissions from Centers for Medicare and Medicaid. They have had a 4-star rating for patient experience and a 3-star rating for quality indicators. The target audience for the recommendations of nurse retention and reduction of nurse turnover is the Chief Nursing Officer, the Chief Financial Officer, and Executive Leadership Team, nursing leadership, which consists of directors, managers, coordinators, supervisors, and charge staff, and also the addition of the entire nursing division. A review of literature was conducted to provide evidence and recommendations to improve nurse retention and reduce nursing turnover. Authors Dempsey and Riley discussed the link of nurse engagement to patient safety and nursing turnover. The authors highlighted emotional and compassion fatigue as a vital role in nursing burnout. Key drivers to influence engagement were nurses enjoying the work that they do and providing high quality of care. Enjoyable and meaningful environment is imperative to reducing nursing environment. Recommendations consist of acknowledging nursing challenges in the workplace, support from leadership, promote empathy and trust from each other, promote teamwork, encourage work-life balance, and improve communication. The authors from the article Effective Strategies for Nurse Retention in Acute Hospitals, a Mixed Mode Study, highlights the need for organizations to focus on improving work environments by fostering participant leaders, develop structured educational programs, and enhance career opportunities for nurses, such as the clinical nurse leader role. The author Shemp discusses appropriate staffing levels that can reduce patient care areas and improve nurse retention. No staff levels were recommended within this article, but the article did recommend to align staffing to a patient acuity. The article Nursing Staff Retention: Effective Factors discusses the emotional factors that influence nurses to stay. The article states that nurse shift requests was the most important factor towards retention. This helps support the nurse work-life balance. Authors Bahama and Laxinger discuss the factors that promote a stressful work environment, including staffing challenges, limited education opportunities, and nurse-to-patient ratios. These factors inflame the nurse burnout, and recommendation areas for improving work life include workload, reward systems, community contributions, staff fairness, and contributions to work. And the last article discussed is projects for increasing patient satisfaction and creating a healthy work environment. This article focuses on improving the culture of an organization by conducting leadership rounds with staff and discussing important organizational nursing topics on a one-on-one level. This information can be vital for the development of new nursing councils and retention strategies within the organization. These articles further support the evidence that nurse retention is beyond pay and equity of pay, but more of the work environment factors that are contributions to nurses leaving and being disengaged within the organization. The American Nurses Association Scope and Standards provides instrumental standards for organizations to help improve retention and turnover strategies, such as Standard 1 assessment, which is collecting pertinent data to review systems and processes within an organization, such as the NDNQI data and the Pathways to Excellence data that demonstrates the need for improving work environment. Standard 4, planning, is to help foster creativity and bring together potential new nursing councils to tack the strategies within an organization to improve nurse retention. And consultation, which is empowering others within nursing councils to provide recommendations that promote change. And standard 5A, coordination, which is bringing different areas of nursing within the organization, within councils, to promote the change and improve the delivery of care. In the standard 2, which identifies problems and trends, we can really utilize the data that I've presented earlier from NDNQI and say, yes, we need to attack work environment and improve the culture of the organization. Through my research and discussing with organizational leaders and staff within the organization, I'm now going to provide some recommendations to improve nurse retention and staff turnover. First is the development of nursing retention council, and this team is really dedicated to implement retention strategies and incentives such as gym membership, child care discount, and even establishing whether the child care center hours are sufficient or effective, maybe 8 hours of paid time off for an individual's birthday, opportunity to provide, go to conferences and hospital educational opportunities, personal services during the work hours such as dry cleaning, oil change, car detailing, um, the car wash, but these are all to be done during the work hours. New technology in the workplace, such as iPads to help mobile documentation, quarterly social events to promote foster teamwork, and gift cards for recognition. And also one other opportunity is maybe an outpatient pharmacy delivery for staff. That would also be another opportunity that the Nurse Engagement Council could conduct. The second recommendation is the development of a new nurse staffing council. And this staffing council is really ideal to implement strategies for addressing concerns of patient acuity and orientation of new staff and productivity measures within a department. So this team can improve staffing models based on acuity and not on productivity grids, such as really looking in isolated staffing measures in specific departments such as emergency department or surgical department and on the floors, look at the physical location of the floors, and really define an acuity system that has a point system, maybe a three-tiered system of a red, a yellow, and a green, and the red is the highest acuity and how many each individual would have on each floor. We would have a real-time productivity tool that staff can help align and develop. Assignments that can display care continuity and can be adjustable for staff input. So as acuity changes and the patient population, then that model will change. And staffing models must be aligned with organizational resources. So we can't go out there and just spend a lot of money just to add additional staff, but really align the resources that we have and come up with a new process that is more productive for staff models. The third recommendation is to develop a nurse engagement council, a team that is dedicated to improve the work environment and reduce job-related stress through rewards and recognition programs, developing shift priorities for staffing, establish a positive nursing culture that really thrives on nursing excellence and nurses feeling connected to the work that they do, and they feel empowered, and the work atmosphere is enjoyable. Nurses that develop floating guidelines, so which nurses can go to which floor, incorporate educational opportunities during the work day, and that all nurses are provided the opportunity and there's no favoritism shown. And once again, to foster these nursing social events that can promote excellence and stories within the nursing profession that really make a difference in individuals' lives. The communication plan for these recommendations must be presented to the Executive Nurse Leadership Forum, which occurs every Monday in the board room in the form of a PowerPoint. But it's also important these new nursing council recommendations to nurse leadership for consideration of nurse recruitment and staffing requirements needed to fulfill these nursing councils, and also to prevent the new current council structure to organizational nursing town halls to all nurses. So everyone in the nursing profession can see, can feel, and understand the value that these new nursing councils has in promoting a positive nursing culture. Budgetary needs are as follows. The department expense for nurse participation in councils. So we need to develop a new budget line item within each departmental budget for nurses to participate in these nursing councils and for directors and nurse managers to appropriately staff when these individuals attend the councils. Educational expenses, so bringing in guest speakers and sending individuals, nurses throughout to conferences about their expertise in the nursing profession. And so we'll once again have to increase the departmental educational expense for this. Nurse retention expense account development, so that will be for social events, that will be for rewards and recognition programs, that will be an allotted amount of money that hopefully will come from the rise in costs the organization has encountered from nurse turnover. So that hopefully this will offset that allotted amount. Nurse engagement expense, that also can be monies for social events, for highlighting nursing excellence, gala, rewards programs, and educational opportunities. And then we'll need an allotted amount for technology improvement, iPads for on-demand documentation for nurses. Evaluation methods of the recommended nursing council development and nurse retention and turnover strategies can be found in future NDNQI survey data and correlating that data to historic survey data to see if there's been an improvement and a shift. Future pathways to excellence survey data, and once again correlating that data to historic data to see if the work environment and the investment of these programs has been successful, and quarterly organizational turnover percentage dashboard development. This concludes my presentation for the Capstone project of nursing turnover and retention strategies. Thank you so much. Have a blessed day.